Good evening, everyone. My name is Liam Moore. I'm a staff member at the American Brain Foundation, and I want to welcome you this evening for How Stress Affects the Brain with Dr. Teshamae Monteith and Dr. Elaine Peskind. Dr. Jeff Iliff was scheduled to join us tonight, but unfortunately was unable to attend due to a last-minute conflict, but he told us himself that Dr. Peskind was even more qualified to do this. And Dr. Monteith was just with us, but might be having a bad connection, so hopefully she can join us again very soon. Our host for the evening is Dr. Phyllis Zee. Phyllis Zee, MD, PhD, is the Benjamin and Virginia T. Boshes Professor in Neurology, the Director of the Center for Circadian and Sleep Medicine, and the Chief of the Division of Sleep Medicine at the Feinberg School of Medicine at Northwestern University in Chicago. She is also the Medical Director of the Sleep Disorders Center at Northwestern Memorial Hospital. A central theme of her research program is understanding the role of circadian sleep interactions on the expression and development of cardiometabolic and neurologic disorders. Dr. Zee has authored more than 300 peer-reviewed original articles, reviews, and chapters on the topics of sleep, circadian rhythms, and sleep-wake disorders. She has also trained over 50 pre-doctoral and postdoctoral students and has mentored numerous faculty members. Dr. Zee has served on many national and international committees, NIH scientific review panels, and international advisory boards, and this year became the chair of the American Brain Foundation's own research advisory committee. Dr. Zee, please take it away.
Thank you so much, Liam. And it's really indeed a pleasure volunteering for the American Brain Foundation. And it's been really important to me because I really see firsthand now the impact that the ABF-funded programs have had on cures for neurological disorders. And very importantly, also the launching of many of our future leaders in neuroscience and neuroscience research. So welcome all, and thank you for joining us for this very exciting, I think, discussion, and certainly going to be very invigorating for me. Tonight, we will learn about how stress affects the brain, including areas that are most vulnerable for chronic stress over time, and how it affects function, your daily life, but also very importantly, we're going to learn how to better manage stress, which is something that I'm sure that we all are very interested in. The webinar events like the one that you're in tonight are really opportunities for us to connect you with leading experts on important topics for brain and neurological care. So we invite you to also put your questions in the chat at any time during our panel, and our panel will then address them all in the Q&A portion, and we'll try to get to as many questions as we possibly can. Just a little bit of background on the American Brain Foundation, or ABF, funds research across the entire spectrum of brain and nervous system disorders. And we're really recognizing that brain diseases and disorders really share many common mechanisms, whether we're talking about Alzheimer's disease or perhaps even Parkinson's disease or MS, multiple sclerosis. They share some common mechanisms. The American Brain Foundation, of course, cannot exist without the generous support of donors such as yourself. If you are so moved, please donate to allow us to fund some of the critical research and educational outreach programs like the one tonight. A really great incentive today is that thanks to a very generous donor, every gift until the end of this year will be matched, or in that case, doubled for the American Brain Foundation. So let's now move into our topic of discussion, which is how stress affects the brain. We are really fortunate that joining me tonight are really two very distinguished leaders and experts in the field. We hope we'll all be joined. First is Dr. Teshamae Monteith, who is an associate professor of clinical neurology and the chief of the headache division at the University of Miami at the Miller School of Medicine. And also Dr. Elaine Peskind, who's a professor in the Department of Psychiatry and Behavioral Science at the University of Washington in Seattle. She is also a co-director of the Mental Health Research, Education, and Clinical Center at the VA Puget Sound Healthcare System. So thank you to the panelists for joining me. And could you, Dr. Peskind, briefly introduce yourself on how stress relates to your work?
Well, I went to work for my colleague and mentor, Murray Raskind, in 1980-ish, before I went to medical school. And starting in 1982, we published many of the really foundational papers, foundational research on function of both the hypothalamic pituitary adrenal axis and the brain's noradrenergic system. These are the two major stress responsive hormone/neurotransmitter systems in aging and Alzheimer's disease. And that was roughly 40 years ago. And then about 25 years ago, the two of us moved from the university to the VA and became, of course, more directed towards the mental health disorders and mental health conditions, particularly affecting veterans. And that was combat post-traumatic stress disorder. And then since the wars in Iraq and Afghanistan, repetitive blast, mild traumatic brain injury. And so, the research center of which I'm co-director, our mission focus is on the unseen wounds of war, which are PTSD and repetitive blast, mild TBI, and their common comorbidities. So this is sort of my trajectory over a 40-year period, and I'll be answering lots of questions about and addressing a lot of stuff we've done and where we've come to with all this.
Wonderful. Thank you so much. Dr. Monteith.
Yeah, hi. And so I'm a headache specialist at the University of Miami Miller School of Medicine. And stress is something that I am very interested in from a clinical perspective, because in treating patients with headache disorders and mainly migraine, stress often plays a role, or at least patients perceive that it plays a role. And it certainly affects the brains of individuals with migraine very much, not just the headache disorder itself, but also the comorbidities that run with it and some of the lifestyle factors that go into disarray. And so I too was very interested in fractures and traumatic brain injury and PTSD. I think some of the things that made me very interested in becoming a neurologist early on is when I did work as an undergraduate with women that suffered from domestic violence or dating violence and had a great deal of stress, and reading some of the early literature suggesting that stress actually can change the brain, brain structures, not just function, but structures itself. I found absolutely fascinating. And, there's a real opportunity to really help people with neurologic disease. And of course, we're very interested in brain health, and stress is just a massive part of that.
Well, thank you. And I myself, I'm a sleep medicine expert. So therefore, this is all about stress.
We should talk.
I should talk. And of course, sleep is one of the major manifestations in some ways physiologically of stress. So this will be a very exciting discussion. So Dr. Monteith, we hear a lot about stress. We're all experiencing stress. Can you explain what it kind of means from a biological standpoint?
Yeah, so stress is very interesting because it's perceptual. You have to perceive stress, and everyone perceives stress differently. So we think about the biology, but there's a cultural component. I think that if a bear was chasing any of us, I think we'll all run. Doesn't matter what the bear looks like, short, fat, hairy, not hairy. We'll all run, right? And so we need stress. It's a protective mechanism. But what happens with long-term exposure of stress is that some of the physiological mechanisms that are supposed to be protective can become maladaptive. And this can result, as I mentioned, in changes in brain plasticity. We're learning more about the role of genetics and epigenetics. And that is also just a whole fascinating area because even some of the stress adaptations seem to be inherited based on some of these early works in animal models. And so it's a fascinating thing. My colleague seems like has done some of the fundamental research with the hormonal disturbances and neuronal hypersympathetic disturbances that are associated with stress disorders and the massive role it plays I would just say not just our immediate, but or even the long-term impacts of stress.
Dr. Peskind, can you expand a little bit on some of the details, especially on your work on hormonal changes and also perhaps changes in brain structure that may occur with chronic stress?
Well, couple interesting things. So first of all, normal aging is associated with increased function or dysfunction of both the HPA, the hypothalamic pituitary adrenal or HPA axis, so increased cortisol, and also increased activity of the brain's adrenaline system, the noradrenergic system. So, and these are both related to aging. They're also even more dysfunctional in Alzheimer's disease. And as Tisha, explained, in an acute stressor, like when the bear or the enemy combatant is, what is very adaptive in an acute stressor. So the body, basically your metabolism and your responses, your HPA and noradrenergic responses make glucose more available. They increase blood flow to muscles. They increase blood pressure and heart rate. They decrease pain. They decrease immune response. Those are all great in the very short run. In the long run, they're super maladaptive. So they lead to all kinds of, metabolic syndrome, hypertension, and both cortisol and norepinephrine have not good effects on cognitive function. So just to do a quick completely inappropriate TMI. I have rheumatoid arthritis, and I've taken moderate doses of prednisone twice for like a 2-year period, like 20 milligrams at first, and boy, do you feel great. You have tons of energy, you don't need to sleep, nothing hurts. But after, but if you're doing it chronically, then really bad things happen. You gain 30 pounds, your face gets round, you develop a buffalo hump and, stretch marks, and your glucose goes up, you get hypertension, you retain salt. It's bad in the chronic state. It's great in the acute state. In terms of the brain, it's a little more complex. So corticotropin releasing factor, which causes, the pituitary to release adrenocorticotrophic hormone, and then that causes the adrenal cortex to release cortisol. It not only is in that brain loop, it's also CRF receptors are widely distributed throughout the brain and have multiple functions and mediated by serotonergic and dopaminergic and noradrenergic neurons. And most of them are probably on balance negative in terms of cognition and anxiety and just, adaptive behaviors in the chronic state. And then norepinephrine is what I call a right-sized neurotransmitter. You need it for attention and arousal, especially to novel or emotionally salient or dangerous stimuli. And so you need it to do the appropriate response to be able to attend to cognitive challenges, but too much actually worsens cognition. So it's the inverted U-shaped curve. There's the right amount, and then there's too much, which worsens cognition. I could talk a little bit about the former glucocorticoid cascade hypothesis if you'd like me to. So in the 1990s, Robert Sapolsky, who was a Stanford, neuroscientist, he hypothesized that chronic glucocorticoids cause a vicious cycle, feed forward negative effects on hippocampal neurons, the area of the brain that is most affected in Alzheimer's disease in terms of loss of neurons. That too much cortisol downregulates glucocorticoid receptors in the hippocampus, and that in turn disinhibits the HPA axis because it releases some more cortisol. It is damaging to hippocampal neurons. This was his hypothesis. And then in 1999, I believe we undertook an experiment, which we thought, we were really excited by this. We thought, this is great. We're going to see if it's, really true. So we had, my only primate study I've ever done. I'll never do another one. But we gave a kind of middle-aged to older, to elderly rhesus macaques. Actually, they were pigtail macaques. We gave them a ton of cortisol for a year, equivalent to an adult human getting 60 to 90 milligrams of prednisone a day for a year. And we gave it to them in a palatable little meatball of peanut butter and potato flakes and stuff they liked, and they all ate it. And there was a placebo group and the cortisol group, and they all looked better and they all gained weight because of the tasty treat. But the cortisol-treated monkeys became Cushingoid, and they suppressed their HPA axis. And at the end of this year, we sacrificed the monkeys and counted by stereologic cell counting. We counted hippocampal neurons and measured cortisol in, all body fluids, basically, plasma and CSF. And we found that with careful stereologic cell counting, it made no difference. So it looked like cortisol in and of itself did not kill off hippocampal neurons. So, I think, so, but it's not good for your brain, and it's not good for cognition.
Yeah.
But and I think we've gone, probably I should stop now and let more questions happen.
Now, that's very interesting. So kind of the bottom line is that this chronic stress can elevate these hormones from the HPA axis. It could be also be the neurotransmitters like norepinephrine, and that may be in the pathway for cognitive impairment. I mean, the work that Dr. Peskind, you do. Dr. Monteith, what about the role of stress on headaches? And I think a lot of work on migraine, right? Like, oh, I have a headache, I'm so stressed. What's that relationship?
Yeah, and this is very, very fascinating. It's fascinating because it's first of all, it's such a common problem. People report stress commonly. And so when you do these diary studies, it's hard to really find a correlation between stress and acute migraine attacks. I think what's a stronger correlation is the stress letdown, where the perceived stress drops, and that seems to be really tightly correlated with diary studies and acute migraine attacks. But largely speaking, in epidemiologic studies and other clinic-based studies, there seems to be some association between perceived stress and worsening acute attacks, as well as major stressful life events and chronification of migraine. So going from lower frequency of migraine to higher frequency of migraine. And that's thought to possibly be on multiple levels, including the increased sensitization that happens, the effect on cortical hyperexcitability that may be associated with the HPA axis itself. And so, so there are a number of really kind of related areas. Another thing that I think is less appreciated is that people that have migraine probably are more vulnerable to daily hassles and typical stressors. And especially that, what we call that prodromal period, that period of time right before a migraine attack, people are probably more vulnerable to typical stress than they normally would be. So that's something about the brain itself, and the ability to process perceived stress is different in people with migraine. So I think that's very interesting. And then, as what has been mentioned, I think between both of you, is the when you're stressed, you're not thinking about, you're not sleeping, your thoughts are racing, you're not eating well, your metabolism is off, your immune system is off. So there may be other reasons why people get headaches in the setting of stress.
Right, and sleep is common to all of that, in the sense that it itself, whether it's due to stress or other reasons, can also have, effects on the autonomic nervous system, increase inflammation, all of those things, which may also contribute to headaches, right?
Yeah. We're learning so much about how important sleep is. It's absolutely, it's starting to freak me out, because I've cheated. I've cheated a lot on my sleep, but that restorative process is not just about memory and and consolidation of memories and clearing of waste, but I think it also resets that stress mechanisms.
Yes. Dr. Peskind, you did some work on PTSD. So, and that the word stress is right there in that condition. So tell us a little bit about how the stress relate to PTSD and changes, in brain function.
So, obviously the word stress is right in PTSD, so post-traumatic stress disorder. And really the fundamental, kind of diagnostic necessity for making a diagnosis of PTSD is a really, really bad acute stressor, often life-threatening, or, obviously there are lots of things that can happen in civilian life, car accidents, sexual assault, just assault in general. Lots of things can happen, but particularly in the military, it's combat stress, where not only is your life in danger, but also you see buddies being killed, and and you see lots of really bad stuff. And I wanted to mention, because I think probably Dr. Monteith is going to address this, that the biggest contributor to post-traumatic stress disorder is previous stressors, and that includes childhood trauma.
Yeah.
So, your likelihood, the more stress of these traumatic stresses you have, the more likely you are to get post-traumatic stress disorder, or PTSD. And it's associated with probably abnormalities of HPA axis function that are more complex than usually thought, but definitely hyperactivity of brain noradrenergic systems. And with respect to HPA axis, it's been long thought that it's actually there's hypofunction of HPA axis and lower cortisol. But again, we did yet another experiment in which we measured cortisol both in the laboratory and had the veterans measure, collect samples at home. The samples at home were completely normal. In the laboratory, in the hospital where I'm, coming to the VA as a stressor for veterans, then they were low. So it looks like you need to have a stressor to express the low cortisol that has been thought of as being very typical of PTSD. And like I said, in terms of noradrenergic function, it's up. CSF norepinephrine is increased in PTSD. And, we have conducted a series of clinical trials using the alpha-1 blocker prazosin to treat trauma, nightmares, and sleep disturbance in PTSD, and it's been found to be effective. And then there's lots more I'm going to tell you about, when we get to it, about glymphatic function, which is one of our big foci of our laboratory now.
Yeah, that's great. Yeah, so it's amazing. So Dr. Monteith, what about Dr. Peskind already alluded to that about children, and how do they respond, differently than adults to stress?
Yeah, I mean, I think the majority of children are so resilient, but there is an impact on particular load of adverse events, stressful life events in children, especially when they're repetitive, things like abuse history, trauma history, neglect history, that is a risk factor for many of the paroxysmal neurologic disorders. Migraine, for example, there's been some great work looking at these adverse events and frequency of migraine, chronicity of migraine. Also, we know people with non-epileptic seizures may have more of these adverse life events. And so there is certainly an impact that it has late life in adulthood.
Yeah, absolutely. What about, like, from Dr. Monteith, along the lines of health disparities, which you have a passion and interest in? Are there race, gender differences in the response to stress?
Yeah. Well, I think looking at stress-related disorders, and a lot of those disorders, I think the best work is done in mental health disorders, anxiety and depression. And some of those childhood events, by the way, are mediated by anxiety and depression. But there's certainly, it's a very complicated thing because there's a lot of stigma in mental health, which is often associated with chronic stress, anxiety, depression. And so, for example, African Americans tend to have lower rates of diagnosis of anxiety and depression. But for those that do get that diagnosis, have more severe forms and more disability and greater social consequences associated with their anxiety and depression. So that's been shown. Access to care is also a major issue, where we know that African Americans are underrepresented, Hispanics are underrepresented in healthcare clinics, less likely to get evidence-based therapeutics for some of these stress-related disorders. And so there's a greater societal impact. There's mixed on the actual diagnosis, but there's certainly a larger level of disability and disproportionate amount of severe disorders that are associated with stress or stress exposures.
Yeah. It sounds like earlier identification may be a problem in these more underserved communities.
Early identification, I think destigmatization is a part of it.
Both.
And as you mentioned, access.
Yeah, those are really, really important. Dr. Peskind, you had mentioned, alluded earlier to stress and neurodegeneration. I think you started with some Alzheimer's, and your work speaks to that. In addition, of course, to the memory, cognitive decline, but there are other neurodegenerative disorders that have also been associated with stress.
Well, there are also, obviously, psychiatric disorders that are associated with dysfunction of stress responsive systems. Anxiety, we talked about PTSD already, and depression are all associated with both dysfunction of both the HPA axis and the brain's noradrenergic system. So this is very common. A lot of what these disorders have in common is sleep disturbance. And I just want to bring this up because I'm going to, Dr. Jeffrey Iliff, who's one of the, pioneers of the brain glymphatic system, was supposed to be the speaker today, but he drafted me. So I'm just going to really quickly tell you about that and why it's so important. So the brain glymphatic system, and glymphatic stands for glial lymphatic system. The brain, there are lymphatic vessels in the dural in the dural blood vessel, sort of tracts of blood vessels, but there are not lymphatic vessels in the brain matter, parenchyma itself. So the glymphatic system is a sleep activated, so it's mostly active during sleep, much less so during waking. And it's literally the brain's own cleaning system. So it's literally, interstitial fluid, sort of, CSF to sort of washes through the brain and clears out metabolic waste, potentially neurotoxic proteins such as, amyloid and tau and alpha-synuclein. It can actually clear those metabolic waste and neurotoxic proteins out of the brain. So, and this primarily active during sleep. So any kind of sleep disturbance will increase levels of these potentially neurotoxic proteins. In fact, it's been shown in even young normal persons that a single night of sleep deprivation causes detectable increase in brain amyloid on PET scanning, which is astonishing to me.
And also in the CSF. Yeah.
Well, CSF too, but even on PET imaging, which is a somewhat blunt tool, it'll show up. Even a single night of sleep deprivation in a young normal person.
There you go. We must get better sleep.
Yeah, and of course, sleep is related to migraine. So often what makes people get better when they have a migraine is sleeping. And then, lots of psychiatric disorders. So people are anxious, they ruminate, they don't, while they're trying to fall asleep and they can't sleep because they're thinking all these thoughts. Depression, which can cause both insomnia and hypersomnia. And then, a manic episode in which people just literally don't sleep for days. Yeah. And the way you get them out of the manic episode is basically to knock them out for a few days and let them sleep. Right. So it just, and if you get a chance, Dr. Iliff has a terrific TED Talk on the glymphatic system. We'll tell you everything you want to know about the glymphatic system, and they'll make you want to sleep more.
Yeah, you can just Google it. You'll find it.
You'll just Google TED.
ILIF, right.
One L, ILIFF as in Frank.
Yes. So, Dr. Monteith, now that, it sounds like, of course, stress has so many multiple effects, and many of those are negative, especially if it's chronic. What can we do about it? How can we kind of help reverse some of those effects and or manage them?
Yeah, that's a wonderful question. I think the first thing is to understand stress. There's stress, perceived stress, and then there's your individual stress response, and that we're all different and we all perceive things differently. And since much of this is on the level of your perception, it's really important to understand that self-talk that's going on in the brain that's processing my environment or even my physiology, and determining the level of stress, which often happens on a very unconscious level. But there's often a chatter that if you can tune into that chatter, it's very helpful, because reframing is a very protective mechanism to help us. I had one patient that I referred to a psychologist, and she was a lawyer and, young and productive. And the psychologist, after the consultation, he has no idea that she's even stressed. She's just so in that mode. And, it doesn't have to be tremendous, but that day to day, you start feeling it on your muscles, you start feeling it on your other body parts, it affects other areas. But that is starting in your brain and working its way down. So I think being aware of your perception of a situation is important. And then, of course, there are exercises that you can do during an acute stressful event, and as well as more chronically, to try and protect you from that. Exercise, the basics, really just the basics. Exercises can be very protective. We talk about all these hormones and all these important sympathetic axes. And so having a regular stress routine can help regulate that sense of homeostasis. So that's an important factor that we mentioned. Having regular sleep, not skipping meals is really important, and the quality of food. So avoiding sugar crashes, highs and lows are important. So having that steady stream of nutrients in your system is important. And then, there are things that you can do. If you realize that you're stressed, you can do regular check-ins and actually, sense, okay, am I feeling stressed? You may, because like I say, it can build up on you. And so, you can even schedule that time where you're going to check in your body and determine, how do I feel? Deep breathing exercises are really, really very wonderful. It's hard to be stressed. It's hard to even be angry when you're doing deep breathing. I've tried it. Like it just short, because the parasympathetics are kicking in, and that's really just a relaxation mode. So that's just some tips, deep breathing exercises. There's progressive muscle relaxation techniques that people can do. There's working with biofeedback and cognitive behavioral therapy, and that's more of having someone to help teach you how to kind of check in on your bodily systems and help to learn how to de-stress. And so those are just a few techniques, and there are other things too. You can just decide you're going to indulge in things that are de-stressing. It could be your Netflix, it could be just comedy, laughing, shutting things down that normally are triggering for you. And that all, I think, starts with awareness.
Yeah, awareness. So, Dr. Peskind, do you have anything else to add?
Well, in terms of kind of the future, I mean, we're now trying to manipulate the glymphatic system to, ultimately to the aim of primary prevention of those neurodegenerative disorders that are characterized by aggregation of abnormal proteins. It turns out the brain glymphatic system is under noradrenergic control. We have evidence now that alpha-1 adrenal receptor antagonist prazosin can actually increase glymphatic function. So we're just at the very infant stages of thinking about this as a extremely low-cost strategy for primary prevention of these disorders. And it's not just Alzheimer's, it's Alzheimer's, Parkinson's, ALS, chronic traumatic encephalopathy. It's and frontotemporal dementia, all of which involve aggregation of abnormal proteins.
Great. Well, thank you very much. Now let's move into the Q&A session. But what I hear is be aware about your stress. I think that's what I heard. And when it's not manageable or it's affecting your health, get help, right? I think, and because it just seems like it can keep going and we're not even aware of that because it becomes a kind of more constant state. So let's go into the Q&A session. There's quite a few very important questions here. The first I will just address, yes, I believe, Liam, I'm not saying it wrong, that there's transcript, that this is being recorded, correct? They just want to know if this will be available.
Yeah, all of our webinars are recorded and posted to our YouTube channel just a couple of weeks after each event.
So anyone can answer this, but it says, can anxiety temporarily exacerbate mild Parkinson's symptoms and confusion?
I just read a headline in the newspaper, but I didn't read the article, that anxiety may be an early manifestation of Parkinson's,
Yes.
But I didn't read the article, so I really can't answer the question.
That's right. I did see that as well. So thank you. The other
I would say the reverse, though.
Yeah.
These sensory tricks that people with Parkinson's sometimes do, that will require some level of, I don't want to use the term mindfulness, but
yes.
Many paroxysmal disorders can be affected by stress, and you think of concrete motor disorders like Parkinson's, but we know they're fluctuating disorders. And so absolutely.
Right. And we know that anxiety will definitely increase tremors, for example, and also these freezing episodes, that patients with Parkinson's get. There's a comment about, it would seem that our wonderful bodies can correct themselves even when we push them. And I think that's what it is true. I think for most individuals, we do overcome many of these, but there are those who stress becomes a chronic situation. And I think, Dr. Peskind, you had mentioned that it is that abnormal response, right? Or that
Right.
chronic response to a stressor that no longer even exists per se,
Right.
that we're talking about a lot. So absolutely, I think our bodies are amazing in being able to do that. Let's see, is there any possible mechanism for how stress induces migraine? Does the HP axis or ANS might be involved in the mechanism?
Yeah, I think that that is the theory that these are involved in migraine. In addition to the sensitization that occurs, the hyperexcitability that is also occurring, the effect on sleep, that migraine and sleep, there are a number of hypothalamic factors that are involved in migraine. We think that the earliest signs of migraine, there's some work that we did with PET imaging, triggering individuals with migraine. We found that the earliest signs of a migraine attack was found in the hypothalamus. And so you can imagine how the important role of the hypothalamus in stress and homeostatic mechanisms and how that could explain that relationship with migraine.
That's great. And also, of course, if you can sleep, you can abort the migraine as well. So these are all just so interrelated. I have a question about how does stress affect the brain of an autistic child? Although sleep aids like melatonin can help produce sleep, is the sleep it produces healthy? Is that a question?
That might be a question for you, Dr. Zee.
Well, melatonin is actually not a hypnotic medication. It is a very bad sleeping pill, actually, from a sleep standpoint. But it is a really excellent, what we call chronobiotic. That means affects the circadian system. And by doing that, it can decrease that arousal that's occurring from the circadian system, and perhaps it helps people fall asleep. Children with ADHD and also children with autism spectrum disorders have abnormalities in the circadian system. It's been shown that they have what we call delayed sleep phase disorder. So they tend to be late sleepers and difficulty waking up. And that's probably why melatonin can help. And in that case, yes, the sleep is going to be healthy and natural. But melatonin itself is not the way we think about as a sleeping pill, but it can certainly be helpful in regulating the sleep-wake cycle. So another question, yes, that's really funny. There's one there. Let me see if I can go down. I am newly insulin dependent. I am a newly insulin dependent 87-year-old woman with high and low glucose readings daily. I seem to manage stress fairly well. How does this affect my brain? I guess the fluctuation in glucose levels.
I would say you don't want to have your glucose level get too low. And, in all the years I took care of Alzheimer's patients where, there was all this focus on careful control of blood sugar, it's worse for a patient with Alzheimer's to have low blood sugar than it is to have high blood sugar. Similarly with blood pressure, you don't want to have too careful control in patients who already have endangered neurons. But if you're so I think it sounds like you still need some adjustment in how you're taking your insulin and what kind of insulin. So I think as talking to your diabetes doctor is in order.
Yeah, I'm not an endocrinologist, but at least from a hospital perspective and seeing people that have physical stress, stress can do both things. It can cause hyperglycemia as well as hypoglycemia. So it's important to, as mentioned, to monitor that. And also, what are your eating habits? Is your day-to-day different when you're having acute stress?
Another question. This is impossible to explain to potential employers. How do you communicate the things that stress you? And are there accommodations? I think people are afraid to tell their employers about it.
Yeah, I think that's absolutely true. I do think that employers have an increased recognition of the role of stress, and some employers are very interested in productivity, but the role of stress, and you see kind of, at least there's been certainly during the pandemic, and I think pre-pandemic, kind of a move towards incorporating wellness programs. Actually, even at our university, there's incentives for joining the gym, getting points, keeping people healthy, and stress tends to be a part of that. Again, I think kind of around the pandemic, post-pandemic, this flexible work schedules, people are recognizing that
Right.
stress can play a role, even if it's driving to work, and that some people are better in safer home environments. And so I think there's still an increase of flexible work. And I know, at least for my patients, we do complete accommodations, and we sometimes mention stress vulnerability and that they can get this work done, but they just need some help environmentally.
So let your either doctor or your provider know about that, and there can be accommodations made. I have a very interesting one here. Says, I'm interested in any insight any of the panel has on how do you shut your brain down? How do you shut that down?
So I'm not sure that you really want to shut your brain down. But I think what you're saying is that how do you turn off that worry that is kind of can be very stress provoking, and that is not easy to do. I think the first step is recognizing that if that's what you're talking about, that is an issue for you, because that awareness, many people again they run around cycling, and they don't recognize it. One trick that I often tell patients is to schedule worry.
Yeah.
You're gonna worry and you're obsessed with doing it and you need to do it. It feels some relief from doing it. Schedule it, and then, say, okay, well, just like a lunch break, you'll have a worry break. It sounds a little snarky, but that is helpful to sometimes do, because when it's time to sleep, it's really time to sleep. And sometimes you have to say, okay, I'm gonna worry in the morning. I'm gonna worry tomorrow.
Yeah, but also think of it as like especially sleep or insomnia is really a 24-hour problem. It's not just about sleep. So I also recommend doing mindfulness therapy during the day, or yoga or some type of meditation. So being aware that you are stressed that moment, then you can implement things that are very, like maybe 10 or 15 minutes where you are able to kind of decrease the stimulation that's coming to your brain for a bit. Dr. Peskind, do you have any?
I noticed the question about, are the over-the-counter sleep meds bad for your brain?
Right.
And, over-the-counter sleep meds are, Somanex, Unisom, Tylenol PM. They all contain between 25 and 50 milligrams of diphenhydramine or Benadryl.
Right.
It is anticholinergic, so it means it works exactly the opposite of the medications that we use to, not the new medications, but the older medications like Aricept and, Razidine that we use for treating Alzheimer's disease symptoms. So, and in fact, when you're doing a workup for somebody who has cognitive impairment, you take a careful med history. They are the most common offender among the over-the-counter medications for causing cognitive impairment. So if you're an older person, it's probably not a good idea to use those over-the-counter diphenhydramine containing sleep meds. If you're a younger person and it doesn't, still, they're probably not great for your cognitive function. But you have to, if you're doing okay, I mean, I couldn't comment, but I would recommend not.
Yeah, and similar to that was like how many minimum hours of sleep. I think that's variable, probably 7 to 8, or even 9 if you're a youngster, definitely. And what's the best time to clean your brain? It is during sleep. And what's the best time to sleep? That depends on your chronotype. Are you an early person? Are you an evening type? So matching your sleep and your eating habits and all of those things with your circadian clock is probably the best way. And there are ways when you can check yourself and see there's this thing called a Munich chronotype questionnaire, which is really neat and easy. It's online. And you can check and see what's your chronotype, and it'll give you feedback about that. So something to look at. All right, some other questions. Why does physical exercise stress improve brain health, but emotional stress does not?
Well, physical exercise actually, in the acute, while you're exercising, it increases stress hormones. After you exercise, it decreases them. So not only does it increase brain, blood flow to the brain and, the rest of your body, but also sort of, I would think of it as kind of using up your stress hormones, and actually results in lower chronic levels of stress hormones.
Yeah, exactly. There's another question about osteoporosis and, or bone function and metabolism. How does stress affect bone function?
Good question. I would say it's probably not good.
Yeah.
Yeah.
I would think that maybe if it increases cortisol and the stress hormones, because we know that like when you're taking steroids, right?
Yeah.
A prednisone, that's one of the side effects chronically is bone osteoporosis, but also even worse, necrosis, but definitely osteoporosis.
We talk about performance enhancing steroids as anabolic steroids, but cortisol is catabolic. It's the opposite.
Right. So it could be. So it's potential. I don't know that people study stress per se on osteoporosis, but indirectly or, based on the mechanisms, I think that could be a possibility.
We know that exercise as a type of stress is good for the bone health. And,
So this is, if you used over-the-counter medications for years, can the damage be undone?
Well, if you're probably, I would, taper off and stop. Mostly it's reversible for taking anticholinergic meds. Yeah.
And I would also say these are not absolute things. You shouldn't be worried about this. These are just increased risk factors for people that associations with people that end up with neurodegenerative disease.
Right.
There are many risk factors, but it's always important to think about reversible causes and what you can do to reduce your risk.
Yeah, I don't think it's any of that. I agree. I think these are risk factors, but also it's just perhaps not the optimal medication to take. Doesn't mean that it's that it's really bad for your brain necessarily. We don't have those types of studies that are totally causal. I think the last question that we may have time for, let's see, it's about sleep apnea. Interestingly enough, how does, the people with, are there any studies that use CPAP versus people with sleep issues who decline versus meditation? Yeah. And I don't know. I mean, CPAP is to treat sleep apnea and not insomnia per se. So I don't think that they would be matched, but also sleep apnea. I think Dr. Peskind, you can speak to this as well. Sleep apnea actually will not only affect your sleep quality, but it itself has been associated with a risk for, Alzheimer's disease. And they share some genetics as well, like the ApoE4 between sleep apnea and Alzheimer's. But clearly, it may also, and it's been shown, I think, Dr. Peskind, maybe it's from your work, that patients with sleep apnea who is untreated also may have alterations in the glymphatic system.
Yeah, one of our junior faculty members, Yelim Cho, is currently doing a study of obstructive sleep apnea and glymphatic function and treatment of OSA with CPAP to improve glymphatic function.
Great. I think we are just out of time, and so I apologize that we can't answer everyone's questions. So very, very sorry about that. But before we say goodbye, I'd like to take the last 2 or 3 minutes to thank you, the audience, for joining us, and of course, thanking Dr. Peskind and Dr. Monteith for a really important and exciting discussion, informative discussion. I wanted just to say also that the American Brain Foundation hosts seminars regularly, and we do invite you to attend those, as many as you can. We'd love to see you again. I also invite you to visit the Brain and Life website. This is produced in partnership with the American Academy of Neurology, and your slide shows how you can access that. There's a link to that. I also want to just again reiterate that you can also support the American Brain Foundation and the groundbreaking research that they fund to find the cures of tomorrow by making a donation. Again, no amount is too small, and that every gift will be doubled by one of our generous donors until the end of the year. So I'd like to thank you again, and I'd like to ask whether our panelists, either Dr. Monteith or Dr. Peskind, have any last words of advice.
Yes. First of all, thank you for the invitation. This was wonderful, and I learned a lot and enjoyed talking to both of you. And I think it's important to recognize that much of this we do have some level of control over. We don't always feel like we do in a world of uncertainty, but stress has a perceptual component to that. And there's so much we can do to live our lives in a healthy way. And I agree that the Brain and Life magazine is a wonderful resource. It has a search function that you can put in some keywords and be able to find great articles to help support you and your brain health.
Yeah, I want to say thank you for the invitation to present today, and to thank for all the attendees. There's a lot of them, and Dr. Monteith, that was your presentation was terrific. I really appreciate it. You too, Dr. Zee.
Thank you very much to all of you and to our participants. Good night and sleep well.
And don't stress.
Don't stress. And subscribe to the news and updates. These are the websites and links, so please take advantage of that for more information.